What is delusional, paranoid disorder? Delusional disorder, also known as paranoid disorder, is a psychiatric condition characterized by the presence of delusions that persist for at least 1 month. These delusions are typically non-bizarre, meaning that they are plausible but still false beliefs that are not rooted in reality. The person experiencing delusional disorder is often otherwise well-functioning, and the delusions do not typically impair their ability to carry out daily activities. However, the condition can cause significant distress and social isolation. The most common form of delusional disorder is persecutory delusions, where the individual believes that they are being targeted or harmed in some way. These beliefs can be quite elaborate, with the individual attributing their persecution to a variety of different sources, including individuals, organizations, or even entire governments. For example, a person with persecutory delusions may believe that they are being followed, spied on, or poisoned by a neighbor, the CIA, or a secret society. They may also believe that they are the victim of a conspiracy, that they are being framed for a crime, or that they are the only person who truly understands what is happening in the world. Other types of delusional disorder include grandiose delusions, where the person believes that they have special abilities or powers, such as being a genius, a messiah, or a celebrity. Erotomanic delusions involve the belief that another person, often someone famous or of high social status, is in love with them. Somatic delusions involve the belief that one has a physical illness or deformity, often leading to excessive medical testing and interventions. Finally, jealous delusions involve the belief that a romantic partner is unfaithful, often leading to accusations and conflict. Delusional disorder can occur in people of all ages and backgrounds, but it is more common in middle-aged and older adults. It affects men and women equally, although men are more likely to experience persecutory and grandiose delusions, while women are more likely to experience somatic and erotomanic delusions. The causes of delusional disorder are not well understood, but there are several factors that may contribute to the development of the condition. One of the most significant risk factors is a family history of psychotic disorders, such as schizophrenia or bipolar disorder. Trauma, abuse, and neglect in childhood may also increase the risk of developing delusional disorder. Other factors that may contribute to the development of the condition include social isolation, stress, and substance abuse. Diagnosing delusional disorder can be challenging, as the individual may be reluctant to seek help or may not recognize that their beliefs are false. A comprehensive psychiatric evaluation is necessary to rule out other conditions that may cause similar symptoms, such as schizophrenia or mood disorders. The diagnostic criteria for delusional disorder include the presence of one or more non-bizarre delusions that persist for at least 1 month, with no other symptoms of psychosis, such as hallucinations or disorganized thinking. Treatment for delusional disorder typically involves a combination of medication and psychotherapy. Antipsychotic medication, such as risperidone or olanzapine, may be prescribed to help reduce the intensity of the delusions. However, many individuals with delusional disorder are reluctant to take medication due to a belief that they are being poisoned or that the medication will harm them. Psychotherapy, such as cognitive behavioral therapy or individual psychotherapy, may be helpful in helping the individual to recognize the irrationality of their beliefs and to develop coping strategies for dealing with them. In addition to medication and therapy, family therapy may be helpful in supporting the individual and helping them to manage their symptoms. Family members can provide emotional support, help the individual to access treatment, and provide a stable and supportive environment. Support groups may also be helpful in connecting individuals with others who are experiencing similar challenges. The prognosis for delusional disorder varies depending on the individual and the severity of their symptoms. Some individuals may experience a significant reduction in symptoms with treatment, while others may continue to experience delusions despite treatment. In some cases, delusional disorder may progress to other psychotic disorders, such as schizophrenia. It is important to note that individuals with delusional disorder are not inherently dangerous, despite popular media portrayals that suggest otherwise. However, some individuals with delusional disorder may become agitated or defensive if their beliefs are challenged, and they may be at risk of self-harm or harm to others if they feel threatened. It is also important to distinguish between delusional disorder and other conditions that may cause similar symptoms, such as obsessive-compulsive disorder or anxiety disorders. Individuals with obsessive-compulsive disorder may experience intrusive thoughts or beliefs that are not based in reality, but these thoughts are typically recognized as irrational and unwanted. Similarly, individuals with anxiety disorders may experience excessive fear or worry about a particular situation, but these fears are based on real or imagined threats and do not involve a fixed false belief. In conclusion, delusional disorder, also known as paranoid disorder, is a psychiatric condition characterized by the presence of non-bizarre delusions that persist for at least 1 month. The condition can be challenging to diagnose and treat, and individuals with delusional disorder may experience significant distress and social isolation. However, with appropriate treatment, many individuals with delusional disorder are able to manage their symptoms and improve their quality of life. It is important to approach individuals with delusional disorder with compassion and understanding, and to provide them with access to appropriate treatment and support.